Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. Before we bring on our guest for today, I wanted to run through a couple of quick announcements. We have our December summit coming up, and tickets for that are available using the QR code or the chat, and we have the link available for that. Make sure you grab your tickets. We also have our Breakthrough Alliance coming up. Our challenge applications are open until the end of October, so make sure that you go ahead and apply. And we also have our Women's Health Tech Challenge, and applications for those are open until September 3rd. So you have a month to fill out those applications to be a part of that challenge. And with that, I would like to formally bring on today's guest, Gracyn Robinson, who is the founder of RENOVAHEALTH. Welcome. Thank you so much for being here today.
Thank you so much for having me, Nina. It's great to be here with you all.
Yeah, absolutely. We are so excited to learn a little bit more about you and what you're building. But I think maybe a great place to start is if you could tell us a little bit more about your professional journey and, what's really led you to where you are right now as the founder of RENOVAHEALTH.
Sure, thank you. So my journey began with interior design. I graduated from Middlebury College, then went to design school at Suffolk University, and for over 2 decades, I worked in various sectors of interior design. So I started out in commercial design, then I segued into residential. And then, once my children were older, I decided to return to working for an architecture firm. So I worked for a few years with a company that focused on life sciences as well as residential, and some more academic portfolio work. And then I segued into senior living and healthcare design. So I was director of business development for LWDA Design, which is architecture, master planning, urban planning, and interior design firm located in Concord, Massachusetts. And so in that role, it was kind of a bifurcated scenario where I traveled a lot in my business development capacity with the head of the firm. And that enabled me to meet a lot of different stakeholders and different interested parties within the senior housing field in terms of influencers, innovators, owner operators within the senior housing space. And then I also got to work on the creative side as an interior designer. So that's really my background. But in becoming involved within the senior housing space and looking at the demographics that we faced, I realized that we have so many people that are turning 65 each day, and we have a dearth in terms of housing supply, as well as senior living. The senior living offerings are becoming very creative, which is fantastic. And fortunately, within the pandemic now, we do see occupancy levels beginning to rise again, which is great because supply chains came to a halt. We had an occupancy scenario which tanked because all of these leaders within senior housing had to protect their communities as best as they possibly could. We lost a lot of people, as you know, but my background in interior design and senior living really led me to want to create a software that will help people in terms of aging in place. My own mom had 5 falls in 7 years, so I've lived the agony of that. And we know a lot of people want to remain in their homes as they age. So if we can somehow, help to get ahead of that very real risk that exists, which is 1 in 3 older adults is going to have a fall, and every 19 minutes, we know that an older adult dies from a fall within a home. Yet CDC studies prove that falls are largely preventable. So if we can get ahead of this, we can alleviate a very costly burden upon our health systems of roughly $101 billion as we're looking out to 2030. So I decided to dive head deep, head first into software development it was about a year ago, and then we reached our prototype 3 months ahead of schedule, and then we became affiliated with HitLab, and now we're in the Apple developer store. We just got into Google for test flighting our app, so that's kind of the next step in the progression.
Wow, that is incredible. I'm so excited to learn a little bit more about Renova, but I think just first learning more about you, what an incredible background. And I could only imagine, being able to kind of come to the healthcare space with that interior design background, and just the broader design background. I could only imagine a very unique and meaningful perspective that has given you kind of to the work that you're doing right now, which is incredible. And I'm just so curious, because you've been in this space and really, I would imagine, got to see the pain points, the gaps, just kind of working from a design perspective. Were there any particular challenges or issues or experiences that kind of became the catalyst of, wow, I really, want to address this, or, this is something that I really want to tackle when you think about just your approach to the healthcare sector now?
Well, I would, in terms of working in business development and interior design within senior living, it enabled me to be able to go on site to a number of different communities. And you see all of the ways in which there are different, program offerings within a community for individuals. And given the real crisis that we have looming in terms of Alzheimer's and memory care, I was so, you see all the different ways in which these leaders are working within their various communities to provide meaningful interaction for residents. And we know that this is not something that's confined to senior care communities. We are facing this within homes, millions of homes and families, and different living scenarios throughout the country. So how we are going to face this and combat this in an empathic capacity, I think, is really going to take on greater importance. And so, I would say that that's first and foremost. I got to see these communities of care, and the ways in which, in terms of the care distribution, that is, so often these communities of care are considered to be facilities. They're not. They are their actual communities. Right. And so I would say, first and foremost, that's number one. And then I think also most people aren't really aware of the falls that exist within their own homes. I've lived this with my own parents, and who lived at a distance. My mom had 2 falls at friends' residences, and then they moved into a rental, and she almost had a fatal fall coming out of her own rental. So, I've had both. In terms of my career, I've had the personal side of it in terms of living the experience, and then I've had the professional side of it in terms of helping to design communities of care, going on site to different care communities, and then we also worked on hospital projects as well. So we were seeing how Boston Medical Center redid their entire maternity wing, and they're a whole new approach to maternity. We see in terms of, I'm thinking of Canon Design, they worked on an open hand doula studio out in Flint, Michigan. And so I think there's a greater awareness that is definitely increasing within society in terms of the need for greater maternity care offerings. And so it's not just senior. I think it's just a way of looking at things more holistically, and how we can help, really turn people's homes into really, areas of care in and of themselves, versus just it's a home. I mean, we know that the patient-centered medical home is on the rise, and we will see, more interventions with the rise of digital health and, wearables. But then we also have, you know, in terms of spatial computing, it allows us the opportunity to bring all different types of care into the home. So
That's incredible. No, that's amazing. And I can just see how all of these inputs, like you were mentioning, your personal stories, the wealth of professional experiences that you've been able to be a part of have kind of come together to really shape your approach to the healthcare sector, which I think is incredible. And I'm so curious. I mean, you were touching on a couple of things that I think even for me, just I didn't really realize the weight of when you were talking about falls, when you were talking about Alzheimer's and some of, memory care being kind of on a significant portion of care now. What are some of kind of the other challenges that you're seeing? I would say women's health, but I think just broader healthcare for seniors. And how is kind of Renova Health and what you're up to really working to address those challenges?
So there obviously we're looking at a scenario of multiple comorbidities. And one of the things that I wanted to share with you is so there was a study that was run looking at in terms of people with and without falls. And there were 11 comorbidities that were studied in terms of cardiac disease, hypertension, diabetes, stroke, vision dysfunction. We know that as people age, their visual acuity declines. And so you need to have spaces that have greater contrast. They looked at frailty, fall history, cognitive impairment, depression, and Parkinson's. And so interestingly, they were saying that comorbidities may alter the rate of frailty among elderly individuals, but not all of the comorbidities mentioned necessarily influence falls. So for instance, diabetes, stroke, vision dysfunction, cognitive impairment did not significantly alter falls within two groups, but in contrast, heart disease, hypertension, frailty, fall history is a big one. We know that if an individual, whether they're male or female, if an individual has a fall within a home, their likelihood of having a successive fall goes way up. And then, of course, there is depression, because if people are depressed, they tend to be more isolated. They remain within their homes. We know that 10 million women have been sidelined within the pandemic from working. So that risk goes up right there for falls within the home, especially if those women are middle-aged. If they are 55 and above, and they've been sidelined from their employment, and they're at home, we're going to see an increased risk. I think another big factor that we need to consider is care avoidance. Due to the cost of care, right. We're looking at super high deductibles, which is leading people to even avoid seeking the care that they need, and that's very costly in the long run, because that's only going to increase. If people don't seek the care that they need, that situation for which they need care it's only going to get worse, and then they're going to land up, in an emergency room. I think we need, obviously, we discussed and touched upon Alzheimer's briefly. We've touched upon cardiovascular disease. We're looking at a physician shortfall. That I think is going to be challenging, and how we approach that, how the government approaches it, how at the state level, community level, we're going to need more physicians, and then obviously a big one is the lack of qualified maternity care. That's very concerning, especially when you look at BIPOC communities. Mm-hmm. It is well documented that Black women, they are not given the quality level of care that they deserve. And many Black women, if there's a book that's called Reproductive Injustice, and in that book, it talks about how a lot of women are seeking, they want care in terms of care provision from OBGYNs that are of their race, their culture. And mm-hmm. So I think we need to do more in terms of helping to uplift these different communities. But certainly for women within the home, in terms of fall risks, uh, a big concern is that once you have one fall,
Mm.
the chance of having another fall goes, sadly, way up. So we need to get ahead of it, well in advance.
Absolutely. And I think as you were really speaking to the comorbidities and I think just kind of the pattern and the behavior, right? When you think about the fall history, I'm I'm just kind of thinking about my own parents. They haven't had any problems, but I mean they're kind of reaching 65 and I'm kind of thinking about it from like a preventative perspective of like, oh wow, like I need to start thinking about this for them. But for you, I mean, being kind of really in this space now where you're kind of able to see and experience all of these things kind of within this kind of senior living sector, how are you kind of thinking about things like personalized medicine or preventative care or kind of, we hear all of these, really key and important topics, but what are kind of some of the ways that you're seeing it evolve? And I'm so curious specifically in kind of the aging in place area, because that's, what you live and breathe.
Well, I think because of thanks to the acceleration of immersive spatial computing, and this is not, this is already being integrated within communities within CCRCs. So whether it be independent living, um, assisted living, memory care, skilled nursing, what we know is that a lot of architecture firms, they're already working in building information modeling, which is 3D. So when as these communities are looking at the things that they need to do in terms of either enhancing the built environment, their facilities, we are now able, thanks to immersive spatial computing, to import interventions. It could be digital, it could be different digital health tools and wearables to be able to show residents, to be able to show the adult children of parents that are looking at these communities. It's a way, I think, to be able to guide people in terms of different care factors that they want to perhaps consider as they are aging in place. So it could be, for example, okay, a friend of mine is the founder of Step 2 Health, and they have he founded a step that has a cantilevered rails to it and a light, so that people, as they are getting out of bed, they have a certain step that they can use in order to be able to get out of bed to reduce the fall risk. Well, what we are able to do now is to be able to show to an individual, okay, you want to consider placing this right here. And then what it does is it's able to connect to commerce, spatial commerce, so that people then have the tools to be able to purchase what they need. It could be, we know that the greatest falls occur between the bedroom and the bathroom. So I think we're going to be seeing, a number of different ways in which care is going to be, thankfully, increasingly available to residents within the home, because we have the ability to allow people to see it thanks to spatial computing.
That is incredible. That's a very exciting, I think, like area of innovation for sure. And you were kind of mentioning, I would imagine, especially with a lot of these innovations, and I think just with the work that you've done of really being able to have that boots on the ground view of where you're kind of talking to residents, you're really understanding their kind of unique pain points and really what's going on. I'm just so curious, what role does kind of resident feedback and satisfaction and all of these things, what does that kind of play in your own work with Renova? And, does that inform your strategy or your services, anything like that?
It definitely does, because we are, in terms of where we are right now in our trajectory, we have entered into, finally, our prototype is in the Apple Developer and Google Play. So what this does is, whether it is patient feedback in a clinical hospital setting, or whether it's resident feedback, whether that be an individual within their own home. It could be someone that is living within a community of care. But to be able to get resident feedback is critically important because it helps us to determine measurable outcomes. And when you're, when you're creating an app that is going to help reduce the risk in terms of falls or provide injury prevention solutions, you want to be able to measure, what the risk is, what the intervention is, and then what is the outcome. It's actually very similar to when, in terms of evidence-based design and the Center for Health Design. I'm a member of the Center for Health Design, and oftentimes, when you're working in evidence-based design and you work on a project, once that project is complete, you want to have 6 months until you return to that site to conduct a post-occupancy evaluation. And post-occupancy evaluations are important because they provide to architects and interior designers that feedback of what is working as a result of these changes in the design. What is not working? How can we, how can it's a process of continual improvement, and I think the same applies actually to, as we see these different forms of innovation that are, maybe they're using AI, maybe they're using generative AI. It's a consistent tool for learning towards efficacy as it pertains to this setting. I just wanted to state that we are learning as we are now testing in terms of AI and generative AI, that it doesn't supplant the need for humans. We still need humans in terms of double checking work, making sure that the dimensions are accurate. But I think certainly in terms of the resident feedback, it is all part of a critical feedback loop towards gaining measurable outcomes in the field.
Absolutely. I love that. And I'm curious, what I think you're kind of able to see so much just from being in the space, from actively like being engaged in the space. And I'm so curious, and I do want to say that, a lot of our participants on the call are also very, very passionate about the space, about aging in place, about really addressing this population, which I think is so incredible to see. But question kind of for you, like, what are some of the either emerging trends in the space? How are you kind of getting your kind of feedback or your news about what's going on in this space? Like, how are you able to stay really at the forefront of all of this? I'm asking because we had some folks that in the chat that were asking about the book that you had mentioned. So also wanted to see if there are any other recommendations that you can share for this group.
Sure. Well, Stan knows this, that I am I'm a podcast junkie.
Love it.
I listen to podcasts to go to sleep. I listen to podcasts if I wake up and I have insomnia. So, it really began with radio advisory. I listen to radio advisory all the time. I actually will return to prior episodes of radio advisory. Then, and there are a number of different ones that I turn to, and I can just tell you kind of offhand, because as we're here, I'd like to share with you, but some of the other ones, the Everyday Wellness with Cynthia Thurlow, that is a great podcast. That's really more about women's health. She touches a lot upon menopause, in terms of hormonal imbalances, weight management, sexual health. I think is obviously important. Mm-hmm. Then Elevate Elder Care. Elevate Elder Care is another one that I tune into. That one tends to have they touch more prevalently upon aging and health. Then surprisingly, so Masters of Scale by Reid Hoffman, he's the founder of LinkedIn. He had one recently about the founder of MIDI. MIDI is, trailblazing startup. She is not a first-time startup. This is her second foray, the founder, but they're really tackling challenges within menopause. And so, I think that just there are the thyroid fixers. Sometimes I listen to that one, but I go to these podcasts as sources of information. And then candidly, I would say, I myself am 53. So I'm right in that period and chapter. So I'm constantly trying to keep myself abreast of different sources of information. In terms of Women of Wearables, that is a community for women that are involved in the age tech and innovation space. So I'm part of that. And then in terms of locally within Boston, you've got Boston Founders Forum. They've got the Startup Boston ecosystem. Right. So about every other week, there are different events where you're talking with all different people that are, some might be involved in age tech, others might be working on a different prototype that's completely unrelated to your own field, but it's a very flourishing inosphere, I guess, I might call it. And then in terms of senior living, that really provided me an incredible opportunity to meet and come across groundbreaking innovators in 2017, 2018, such as Kyle Rand of Rendeavor. He is using virtual reality in reminiscent therapy, and it is incredible to see what he has done. Then there's Matt Reiners, who's the founder of Eversound. I got to, see the work just as they were beginning within the space and watch them now. I mean, Matt's already sold his company. He's still very involved with it. But, you come across a lot of different people that are so passionate about wanting to help improve the lives of others and serve others in a meaningful way. And it's just, I've found it's a privilege to work within the senior housing space because people are so passionate about what they do. And it's an industry that is really working towards, the needs of others and helping others. So what I'm doing, I'm trying to help individuals at home, but hopefully it can serve as a bridge between both really, aging in place and community. And then you've got individuals that are, senior living is looking at aging in place every day. Right. It's what they do. So I hope that helps to answer.
Yes. Absolutely. I just realized, Gracyn, we are at time. Where has the time gone? I feel like that was such an incredible conversation. I think we were all very furiously taking notes when you were giving all of these incredible recommendations. And I think a testament to our amazing participants who are listening in, as well as yourself, this is an area of such passion, of such interest, and really kind of speaks to, aging in place and a lot of these factors as something that can really provide a lot of meaningful impact. So I really appreciate you taking the time to chat with us today.
Thank you.
Yeah, and for folks on the...
Thank you so much for having me.
Thank you so much.
It's a pleasure to have been here. I appreciate the invitation to speak with all of you that are here, and please follow up if you have any questions. You can reach out to me. I'm on LinkedIn. So thank you so much.
Thank you so much, Gracyn. And she is on LinkedIn. We have her link in the chat if anyone is interested in connecting and asking any additional questions. Really appreciate Gracyn for taking the time to chat with us. Make sure you check out our next Women's Health Tech Wednesdays. Wanted to give a quick thank you to our sponsors for sponsoring this conversation, as well as one last huge shout out to Gracyn for such an enlightening conversation. Really appreciate you taking the time, and we will see you all next Wednesday. Bye,
Thanks again, Nina. Thank you. Take care.
Thanks,
All right.